I gave 3 presentations, and the first presentation was about the importance of gonioscopy. Gonioscopy is an examination where you evaluate the configuration and appearance and possible changes in the chamber angle. You need this examination for differentiation if you have open-angle glaucoma or angle closure. It's an examination which is not so frequently done as it should be, actually. But it's on the other side, if you know it once, then it's really no problem to do so. And it's elementary to have the right diagnosis of glaucoma. The second talk was about the importance of visual field testing, which is another essential examination that you need to perform. You make visual field testing with computer-assisted systems. You need it not only once in the life of a glaucoma patient, but depending on the stage and the rate of progression, you should perform this examination between 1 and 4 times a year, depending really on the individual patient. You need it for ocular hypertensives as well as glaucoma patients. You should repeat it all with the same machine. It's a psychophysiological examination. That means it can be influenced by less concentration of the patient, or if he's tired or so on. So it could be that you have to repeat it, and you have to instruct him in an appropriate way when you make this examination. And based on this visual field, which gives you a hint about the quality of life of this patient, your care to the patient, and what you will do if you make more treatment or if the treatment is sufficient. For that, you need the visual field. And the quality of life, and that's the thing that counts for the glaucoma patient, is defined more or less by the visual field and its potential defects. The third presentation was about the role of preservative-free medication in glaucoma. And we know that glaucoma is a disease of the elderly, and it's a chronic disease, a chronic progressive disease, which needs for the entire life medication. Glaucoma patients, as an average, get treatment for at least 20 years. On the other side, we know patients have very often dry eye, so any kind of ocular surface disease. That's again a chronic disease which occurs more the older you get, the more likely you have it. So they have very lot of similarities. The conventional eye drops usually have preservatives in it, which is benzalkonium chloride. And we know that benzalkonium chloride has a negative influence on the conjunctiva, causes signs and symptoms like itching, foreign body sensation, redness of the eye, and so on. All these side effects can reduce the compliance of the patient, so they are less likely taking their glaucoma medications. And now we have preservative-free medications, which are much better tolerated, and the patients are more likely to willing to take these drops. We have these preservative-free medications in monotherapy and in combination therapy. The first prostaglandin preservative-free launched, that was saflutam, which you give once a day as well, only in the evening. And it's really an excellent tolerability and very little rate of signs and symptoms of these patients, but a very good IOP lowering effect. Please perform gonioscopy, number 1. If you want to make the proper diagnosis of glaucoma, you cannot replace this examination with anything, so you have to make gonioscopy. You should make gonioscopy in both eyes. You should make it in a dark room. You should make it after tonometry measurement, and it takes maybe 2 minutes or 3 minutes to perform it for each eye maximum.